because eating is not for faith, for whatever does not proceed from faith is sin. And the reason I chose this scripture is because usually with diabetes, it's going to pertain to dietary intake for the most part. To begin with, I am here today, I'm going to discuss pre-diabetes, which is the focus this year for the National Diabetic Association. And I'm also going to give you some information on how COVID has an impact on patients who are diabetics. Okay. November is National Diabetic Month, a time when communities comes together to team up to bring attention to diabetes. As I said, this year it is focused on pre-diabetics. Pre-diabetics are patients who are running, people who are running slightly elevated blood sugars, anything between 120 to 150. And oftentimes they're not aware that they are running these elevated blood sugars until they go into the doctor, have a physical exam, or what have you. But whenever you start running elevated blood sugars, you are somewhat a pre-diabetic. And at that time, you want to make sure that you start taking measures or doing things to prevent or decrease the possibility of you becoming a diabetic type 2. There are no clear symptoms of pre-diabetes. So you may want to they almost always have pre-diabetes. Pre-diabetes is a serious illness where your glucose levels are higher than normal, but not high enough to be diagnosed as a diabetic type 2. According to the CDC, there are more than 1 to 3 adults that has diabetes, pre-diabetes, and not aware of it. Some of the signs and symptoms that you might have as a pre-diabetic, and this is pretty much for your diabetic type 2 as well, but some of the signs and symptoms, mild signs and symptoms that a pre-diabetic might experience would be a urinary tract infection or a yeast infection. Oftentimes when we get in our 40s, 50s, or 60s, we're more prone to urinary tract infections. Oftentimes they will go to the doctor and they're diagnosed with urinary tract infections, but the thing about having a urinary tract infection, that will cause the blood sugar to be more elevated. As the infection gets worse, then the blood sugar goes higher. So you definitely want to pay attention to that if you think you have urinary tract infection or yeast infection. You also will have increasing urination. Oftentimes people will get up throughout the night, 2 to 3 times a night, or during the day even, after they've had a meal, and they notice that they are going to the bathroom just back and forth, back and forth. And if you're experiencing frequent urinations, that's one of the things that you definitely want to take notice to. Increase in appetite. When a patient is experiencing elevated glucose level or even low glucose levels, they could be complain about being very hungry. And all they want to do is eat and eat and eat. They might have just had a meal, but yet it's still their body is requiring them to eat more, which is not quite normal because, once you eat, then you should be satisfied at that point. But if pre-diabetics or diabetics, oftentimes appetite increases. You might have excessive thirst. And usually thirst comes from when, because of the excessive urination, because with the excessive urination, your kidneys are trying to get rid of the glucose. And the more it tries to get rid of glucose, you're going to urinate more because it's trying to flush the glucose out of the body. So if you're experiencing thirst, that's probably because you have been experiencing excessive urination. And also, along with the thirst, you could also become dehydrated, as well as your electrolytes could become imbalanced, which is going to make you very tired and very fatigued. So if you notice that you are thirsty, urination, and also feeling tired and exhausted, make sure you follow up with your doctor. You could also have mood swings. People that has low blood sugars usually end up having mood swings. And so if you're experiencing that you're up and down, one moment you're jittery, which is a high blood sugar, next day you're having a mood swings. You're sad, you're just temperamental. Make sure you follow up. Over the years of being a diabetic, just to tag on something to what I just said so far as the symptoms, you might experience numbness of your fingers, or you might experience visual problems because of the elevated blood sugars. And this is the time now, if you're having any of these signs and symptoms, that you address it now to prevent going into becoming diabetic type 2. If you are having, as I said before, any symptoms, we'll notify your doctor. And when you notify your doctor, he will draw a fasting lab, hopefully, and fasting blood sugar to see if your blood sugars are elevated, even if you hadn't had anything to eat. In addition, they will draw an A1C. An A1C is a test that is done to check your blood to see if how many molecules of sugars attached to your hemoglobin. And of course, this test checks your blood sugars, your elevated blood sugars over the last 3 months. And usually though the A1C, if you are below 5.7, I believe, you're normal. Your A1C is normal. Anything that's above 5.7 to 6.4, that means that you are pre-diabetic. And 6.5 and above, you are diabetic. And the way you want to make sure that you don't get to the 6.5 is you start changing your lifestyle. Start doing something to make a difference in your lifestyle. Healthier lifestyle changes. And this is what's going to make a difference, because what you don't want to do, you don't want to become a pre-diabetic and do nothing because you are having some signs that you are experiencing some elevated blood sugars. But you want to make sure that you change your lifestyle. You want to start eating better, become more active, watch your weight, okay? And the good news about this is that if you change or do something about your lifestyle now, there's a great possibility you will not become a diabetic, or you can reverse diabetes. But it's a continuous thing. If you start out exercising, dieting, and being more active, then it's something you have to continue on. It's a lifestyle change. It's something that you would do every day. Some of the tips to help manage pre-diabetes and prevent diabetes would be take small steps. If you try to just jump in there and just do everything at one time, try to do a whole bunch of exercise, like walk for an hour, and you get frustrated, and then you don't want to do it anymore. Start out maybe walking 15 minutes a day, or maybe 30 minutes a day. But make sure if you're going to walk 15 minutes a day, try to do it every day if possible. Another thing would be move more. You want to make sure that oftentimes we become complacent and we'll just sit still, watch TV, and really not doing much, just sitting back and relaxing. Just move more, find a hobby, find something else to do, go outside of the home, volunteer, do some volunteer work, just continue to be active. The key to diabetes, burning blood sugars, is to literally do something to decrease the levels in your bloodstream. Oftentimes, people who are diabetics, they even control their blood sugar by walking or doing exercises. Some of them go into the gym, maybe spend an hour a day or hour 3 or 4 times a week exercising just to manage their blood sugar so that they don't have to be on insulin. Because just as sure as your blood sugar runs out of control as a diabetic type 2, you eventually advance to become a full diabetic. I know some patients, they've had an A1C of 14. Those patients, anything above, I would think 10, 14, or what have you, those patients are placed on insulin. and it's already difficult enough to have to stick yourself just to find out what your blood sugars are. But in addition to having that additional stick with insulin, and that would be one of the things that a person that has a A1C of 14 would require. You would have to take insulin. So as long as you have not advanced to the diabetic type 2, you're doing really well, because you don't want to become a type 2, then of course you become insulin dependent diabetic.